Kidney damage often begins with repeated daily exposure. Kidney disease rarely starts suddenly. It develops slowly through repeated metabolic stress. Most people associate kidney damage with dehydration or excessive salt. In reality, the most consistent driver is chronic glucose exposure from refined carbohydrates and ultra-processed foods consumed daily. The kidneys filter approximately 180 liters of blood every day. They regulate electrolytes, fluid balance, acid-base stability, and blood pressure. They are highly vascular organs with dense microcirculation. When blood glucose rises frequently throughout the day, the kidneys are forced to filter higher glucose loads repeatedly. Inside the kidney, glucose is filtered through the glomerulus and then reabsorbed in the proximal tubule. This reabsorption process requires energy. It increases oxygen demand within kidney tissue. Chronic high glucose increases intraglomerular pressure. The small filtering units begin to experience mechanical stress. Over time, this leads to thickening of the filtration membrane. Elevated insulin also contributes. When insulin levels remain chronically elevated, sodium retention increases. Blood volume expands. Higher pressure inside the glomerulus accelerates structural damage. Repeated exposure does not cause immediate symptoms. Kidney function can decline gradually while routine blood work remains within normal range. The most dangerous aspect is frequency. It is not a single meal. It is daily exposure. It is repeated glucose spikes. How daily glucose spikes damage kidney microvasculature. The kidneys rely on an intricate network of microscopic blood vessels. Each nephron contains a glomerulus, which functions as a high-pressure filtration unit. This structure is extremely sensitive to metabolic stress. When you consume high glycemic foods daily, blood glucose rises rapidly. The pancreas responds with a large insulin release. If this pattern repeats over months and years, the kidneys are exposed to persistent metabolic strain. High glucose increases the formation of advanced glycation end products. These compounds bind to structural proteins in the glomerular basement membrane. The membrane becomes thicker and less selective. At the same time, oxidative stress increases inside kidney tissue. Reactive oxygen species damage endothelial cells that line the microvasculature. Nitric oxide signaling declines. Blood vessels lose flexibility. Glomerular pressure rises. The kidney initially compensates by increasing filtration rate. This state is called hyperfiltration. It may appear normal or even elevated on laboratory testing, but hyperfiltration is not a sign of strength. It is a sign of overwork. Over time, persistent high pressure damages podocytes. Podocytes are specialized cells that maintain filtration integrity. When they are injured, small amounts of protein begin leaking into the urine. This leakage may be minimal at first. It often goes unnoticed. Chronic insulin elevation compounds the problem. Elevated insulin promotes sodium retention and increases systemic blood pressure. Higher systemic pressure further increases intraglomerular stress. The damage accumulates slowly. You may feel normal. Energy levels may remain stable. Routine testing may not show dramatic changes early, but structural remodeling is occurring. The hormonal cascade that amplifies kidney damage, kidney stress, is not only mechanical, it is hormonal. When refined carbohydrates are consumed daily, insulin remains elevated for extended periods. Chronically high insulin activates the sympathetic nervous system. This increases vascular resistance and raises baseline blood pressure. Higher blood pressure increases glomerular filtration pressure. This accelerates structural stress inside the kidney. Insulin also stimulates the renin-angiotensin-aldosterone system. When this system is activated chronically, angiotensin II constricts the efferent arteriole of the glomerulus. This raises intraglomerular pressure even further. Aldosterone increases sodium and water retention. Expanded blood volume amplifies systemic and intrarenal pressure. At the same time, visceral fat accumulation often develops alongside repeated glucose spikes. Visceral fat produces inflammatory cytokines. These cytokines impair endothelial function inside renal microvessels and increase oxidative stress. Cortisol can compound the problem. Chronic metabolic instability disrupts sleep and increases stress signaling. Elevated cortisol further increases blood pressure and enhances sodium retention. This creates a reinforcing cycle. Higher insulin increases blood pressure. Higher blood pressure increases glomerular strain. Glomerular strain increases inflammatory signaling. Inflammation worsens insulin resistance. The kidneys remain in a state of constant regulatory stress. Importantly, this hormonal cascade can begin years before overt kidney disease is diagnosed. Why early kidney damage often goes unnoticed? The kidneys have a large functional reserve. You can lose a significant percentage of nephron function before symptoms appear. This is why early damage is often silent. During the early stages of metabolic stress, the kidneys compensate through hyperfiltration. Glomerular filtration rate may remain normal or slightly elevated. Standard blood markers such as creatinine may not change significantly. This creates a false sense of security. Meanwhile, structural changes are developing at the microscopic level. The glomerular basement membrane thickens. Podocyte density gradually declines. Small amounts of albumin begin leaking into the urine. Microalbuminuria is often one of the earliest measurable signs. However, it is not always tested routinely in individuals without diagnosed diabetes or hypertension. There may also be subtle increases in uric acid levels. Elevated uric acid reflects metabolic strain and reduced renal clearance efficiency. Over time, this can contribute to further endothelial dysfunction. Blood pressure may begin trending upward gradually. Even mild elevation increases intraglomerular pressure and accelerates nephron stress. Fatigue is sometimes reported, but it is nonspecific. Many individuals attribute it to lifestyle factors rather than early renal strain. Because the kidneys compensate effectively for years, structural injury can progress quietly. By the time creatinine rises noticeably or estimated filtration rate declines significantly, damage is often advanced. How to reduce daily kidney stress and protect long-term function if repeated glucose spikes drive early kidney stress. The solution begins with metabolic stability. The primary goal is reducing chronic insulin elevation. Resistance training increases skeletal muscle glucose uptake and lowers circulating insulin levels over time. Aerobic conditioning improves mitochondrial efficiency and reduces oxidative stress within vascular tissue. Stabilizing blood glucose reduces intraglomerular pressure. Fewer sharp glucose spikes mean less hyperfiltration and less mechanical strain on the filtration membrane. Dietary structure matters. Minimizing ultra-processed carbohydrates reduces rapid glucose absorption. Increasing fiber intake slows glucose entry into circulation. Adequate protein intake supports muscle mass, which improves insulin sensitivity and metabolic buffering. Blood pressure control is equally important. Even mild hypertension accelerates glomerular damage. Improving endothelial function through physical activity and sleep regulation helps restore vascular flexibility and nitric oxide signaling. Sleep quality plays a protective role. Deep sleep supports hormonal balance and reduces evening cortisol. So, lower cortisol reduces sodium retention and vascular reactivity. Hydration also supports filtration efficiency, but hydration alone cannot compensate for chronic metabolic overload. The key insight is this: the most dangerous food for your kidneys is not defined by a single ingredient. It is defined by daily metabolic impact. Repeated high glycemic exposure creates sustained insulin elevation, vascular stress, and intraglomerular pressure. Kidney damage rarely begins with pain. It begins with silent metabolic strain that accumulates over years. Protect metabolic stability early, and you protect renal function long-term.